with Amare. So today we are going to talk about the difference between lipedema and lymphedema. So why are we talking about this? Because one of the things that a lot of people get liposuction for, that you guys always say, oh, it's like cosmetic, whatever, is lipedema, which is painful fat syndrome. That is why people get the lipo for their legs in certain targeted areas. And it's one of the very well-known ways to keep it under control or treat it. So all of this has to do with the lymph system and swelling, not just post-op, but the lymph system in general. So let's start with, what is lipedema? Lip, or Lipoedema, is how it's spelled. That is painful fat syndrome. Basically, it's where your body deposits fat in areas that it's not supposed to, or it just has this accumulation of fat in certain areas. Now, they say the main difference between lipedema and lymphedema is that lipedema, painful fat syndrome, is only common in women. That is false. I treat lots of men who have the lipedema problem, where the fat transfers to their legs or their arms severely. And it's, you'll see those pictures of, like, and I'm going to post one for our before and afters this week, just for, knowledge. But it's where it's like cellulite to the max. It's huge. Your legs, your thighs get huge, your arms get huge, and it's very, very painful. Now, it's not just painful on your joints, but your skin is actually painful. So basically what happens is your body overproduces fat cells, and it puts them in those areas. So the tops of the thighs, the underneath of the arms. Now, it's not just like, oh, I've got a little arm fat. It's like excessive. It's a lot. Where the common body type that you'll see is a very tiny waist, very tiny ankles and calves, really, really, really big thighs, and really, really, really big, like, arms underneath here, even on the top, really, really, really big arms. And as it accumulates and builds up and gets worse, it does spread downward towards the calves, like over the knees. You'll see that giant pad of fat over the knees, and over the elbows as well. And it just looks really weird. It's not a normal fat accumulation, and it's very, very painful. Lymphedema, which is your lymph system, is a chronic swelling condition. There are two forms of it. So there's primary lymphedema, which is where you're born without the vessels that are meant to suck the fluid back from your tissues so your body can absorb it and pee it out. You're born without those vessels. So it's part of the lymph system. We all know what lymph nodes are, right? So you're born without this part in your lymph system that helps you control the swelling. So you have massive legs, and they're really swollen, or arms, and sometimes both. And lymphedema commonly is in one leg and not the other, or one arm and not the other. Now, it's not that it's not in the other, it's just not as bad on that side. So you'll see one side where there's swelling that's asymmetric, where it's huge. The whole limb, ankle, knee, thighs, calf, the whole thing is really, really big and swollen. Sometimes, because of that swelling, discoloration of the skin, you bruise extremely easily. I mean, like, a feather drops on you and you bruise. Skin is really flaky and falling off. Sometimes there's even sores that bust open and leak, weeping wounds, things like that. That's a chronic case of lymphedema. Now, where the two cross over. So we know with lipedema, painful fat syndrome, you can get liposuction to get the fat sucked out, so that helps kind of manage it, which is a lot of times covered by insurance, but not all surgeons do liposuction for lipedema. Lymphedema, they do have a surgery in California, an experimental thing, where they can kind of, I'm not exactly sure of the science, but basically they're reconnecting the lymph vessels so that your body can start rerouting where the fluid goes, so it doesn't keep pooling in your legs or in your arms, wherever you have the lymphedema. Now, lymphedema of the lymph system, the swelling problem, without the painful fat, but the painful swelling problem, is very, very, and most commonly linked to breast cancer. Because when they remove lymph nodes from that area where the breast cancer was, or do radiation and fry them, that whole arm, and usually it's the left side, that whole arm will blow up, and you will get a nice thick pad of swelling, and it'll be very, very painful. And there'll be a noticeable difference in the puffiness from the wrist all the way up to the shoulder, sometimes the elbow, all the way up to the shoulder, that whole area where it's very, very swollen and tender, and it hurts. And it's not the same kind of swelling. Not a technical term, but the way that I describe it: hot swelling and cold swelling. So hot swelling is, I stubbed my toe and it's hot and it hurts and it's swollen. Cold swelling is, it's not hot, but it hurts and it's swollen and it's big and it's there all the time and it's not going down. That's how I describe it. That's just me. Lymphedema swelling is more of what I say is congestion or cold swelling, where it's there all the time and it's really swollen. It can get hot if it's that swollen to where it's ripping the skin. But that's lymphedema, and that most commonly happens as a symptom of removing or damaging lymph nodes in that area from where the breast cancer was. Now, it doesn't just happen in the arm. If you've had ovarian cancer or something like that, you can absolutely get lymphedema in your legs. It's a rare thing. I've seen it happen, though, where the legs blow up and the stomach blows up from having the lymph node removal due to cancer. So that's lymphedema. That's where your lymph system has edema or swelling. Lipedema is painful fat syndrome, where your fat cells are basically out of control, depositing fat everywhere. Now, with lipedema, like we said, you can get liposuction, but a secondary condition of that is lymphedema, which is swelling around those fat cells that make it extremely painful. That's a lot of times where the painful part of the painful fat syndrome, lipedema, comes from. So we know liposuction is fat removal. Lipedema is fat swelling. So it's basically all of that extra fatty deposits that's, blowing up in your legs, where your legs are really heavy and putting pressure on your joints. The swelling pockets around all of that fat, and it becomes really, really painful because now you have all this excess weight and it's swollen around that. So common treatment for both, and something before you go and get your surgery, your liposuction done for your lipedema, your painful fat syndrome, your doctor will advise you to go get lymphatic drainage done. Manual lymphatic drainage, hands-on, fodder style, gentle, manual lymphatic drainage, to help get the swelling down so they can make the surgery more successful. A lot of surgeons that are doing liposuction for lipedema, painful fat syndrome, do not want to have any swelling in that area and will tell you to make sure you go get lymphatic drainage done for a couple of months before even getting the surgery to get a lot of that swelling off, because what happens is if you have a lot of swelling in that area, making that fat painful, and you go get the surgery, we all know after surgery you swell for a while if it's not taken care of and under control and you're not getting manual lymphatic drainage massage. So they tell you to do it before to eliminate all that swelling, because once you get cut, you're going to have 10 times more swelling on top of the 10 times of swelling that you already have around that painful fat. So manual lymphatic drainage does help reduce lipedema pain, but it will not get rid of the fat. The fat needs to be liposuctioned out. Lymphedema, again, which is painful swelling, just the swelling itself with not the extra fat deposit, that is something that we do manual lymphatic drainage for regularly. So that helps keep it down. Things to do at home and to help with both of these conditions: medical grade compression garments. Now that's not like, as we know in post-op surgery, the full body compression garment where it's like a suit. That's usually a glove and sleeve or medical grade compression leggings, not stockings, leggings from Jobs, Sigvaris, Juzo, Lymphedivas, wherever you're getting it from, but that are actually fit for your body to keep the swelling out. Now, the biggest problem I see with you guys getting these medical grade garments, one, you're not getting fitted for them. You're just going on Juzo or Jobs.com and you're ordering whatever the closest garment is to your size, which is okay, but it's not really going to do what we want it to do. The second thing is when you go to actually measure for these things, you are so beyond swollen. Then when you wear the garment, let's say for like 2 or 3 days, the glove and sleeve, your swelling goes down and then it doesn't fit. And then your body winds up blowing back up into that garment to fit the garment. And it's this rebounding effect where your swelling never really goes down. It comes and goes at the same level all the time. So getting your manual lymphatic drainage done with me specifically, I will make sure that we get you down to baseline before we go ahead and fit you for a medical grade compression garment. Because again, if you have all of that swelling and you wear the garment, it's going to just kind of stick and then rebound at that same level. So when you are going for your garments, make sure that you're getting treated by a actual lymphedema certified lymphatic drainage person, a lymphedema specialist like myself, where we can actually get you down to baseline and then get you fitted properly for something that's going to hold you without squeezing or without making sure that you're blowing up and doing that rebounding effect. So that's a little bit on those two conditions. Again, one of the things we see in the post-op world that is huge is getting liposuction for painful fat syndrome. With that being said, you need to make sure that you're taking care of it afterwards, because you will blow up again like crazy with the swelling. And again, making sure you have proper garments post-op. And then even after you're done with post-op healing, getting you into a base garment so it doesn't happen again and you're not swelling up even when your body is accumulating that fat. Now, That painful fat syndrome, lipedema, that is a genetic condition. So that's just one thing. It's a genetic condition and it gets worse with age. And hormones. Hormones are chemical messengers. This is my third and last point for this video. Hormones are chemical messengers. Hormones control when you swell. Ladies, as we know, we have a cycle. We get bloated, we swell. That's hormones. So as you get older, once you start going into menopause, or it also is triggered when you are preteen and your hormones kick in, all of a sudden your legs blow up. All of a sudden your body starts accumulating this fat like crazy out of nowhere in these fat pockets around your thighs, around your knees, and it's excessive and you can't get pants on. So one of the things that triggers lipedema, painful fat syndrome, where the fat's accumulating like that, is hormones. So that's part of it, and also genetics. So they see it a lot, and when you're younger, nobody really thinks about it. They just say, oh, exercise, whatever, you manage it, you exercise, you're active. As you get older, as you start getting into that menopausal phase, or even with men, when your hormones change and start to slow down and you have that change in your body, that flux, your body will start to react differently to things. So it may get a lot worse. One, because it's been a buildup over time, and two, because now your hormones are changing and it's kicking in and it's starting to activate that a little bit more. So a lot of times we see it in people in the age range from like 40 to 50, where it's getting really bad. Like your legs are so swollen, you're having to have a knee replacement surgery because there's so much fat around your thighs. And then somebody finally diagnoses you with lipedema. Then you go get the surgery. And then, we work with it from there. But it usually happens when you're at that older stage and it starts to get out of control. Now, lymphedema is the same thing. It doesn't always just happen, the swelling doesn't always just happen from a breast cancer removal. There are a lot of women that I treat that once they hit that 40 to 50 range, they start having this excessive amount of swelling in their legs, like crazy amount of swelling in their arms. They just blow up. And you guys say you're retaining water. Well, yeah, you're not retaining water. Your body's blowing up because chemical messengers are changing and your body's holding on to that swelling. So yes, it could be lymphedema if you're diagnosed that way, or it could just be a change in hormones that's causing your body to accumulate a lot of fluid. So it may not be lymphedema specifically, and it's a very, very common thing that it gets misdiagnosed all the time. I have tons of people that come to me and they're like, yeah, my primary said that I have lymphedema and I need to see a specialist, so I came to see you. And I'm like, okay, well, do you have any actual conditions that have, proven to cause this? Have they done the research to kind of see if this was a genetic thing where you've had it since birth and never really thought about it, or did this happen because of hormones? Is it primary or is it secondary? Secondary lymphedema is depending on what it's from. If it's from cancer, you constantly have to maintain it. But secondary lymphedema coming from just a normal hormonal change, that's something that we can very easily manage, and you may not need a compression garment for the rest of your life. Something where there was a lymph node removal, secondary cause like that, or damaged lymph nodes or something like that, where you don't have those parts anymore to get your body to process that fluid, that's something we may need to do management with, as far as lifestyle, as far as diet, and as far as a compression garment to make sure you don't blow up. Dangers of not managing lipedema and lymphedema together. You can absolutely damage your skin and not just need liposuction, but actual skin removal as well, because your skin is being stretched by that swelling and stretched by that extra fat for so long, it breaks all the elastin and that never comes back. It destroys everything in there. That can also really lead to some serious health conditions. If you have that much swelling where it's super painful and super noticeable, there's discoloration of your skin. It's not as your skin doesn't have as much pigment as usual. It starts to turn kind of ashy, or start to look kind of dull. Maybe it's even turning colors like blue or purple normally, which is super scary. You're cutting off blood supply. The pressure in your vessels and under your skin from the fat or the swelling is sitting on your blood vessels, and you can get clots. You're cutting off circulation. Your skin and your tissue are going to start to become necrotic. I have seen it all, and it can be a really big mess if it's left unchecked. And a lot of times it's, again, misdiagnosed. So if you are looking down this rabbit hole at lymphedema or lipedema and trying to figure out what it is, I hope this is a little bit helpful. If you have questions and would like to set up a virtual with me about compression garments, medical grade, fitted, proper compression garments for lymphedema or lipedema, or if you're interested in having the surgery, I do have some good contacts for that as well. Give me a call, set up a virtual, 732-841-0142. And if you need to, like I said, get fitted for a compression garment or need to know where to start, I do know that a lot of doctors will send you to Sloan Kettering or they'll send you to like a physical therapy place to manage your lymphedema, which is like the most common thing that people have is lymphedema. They'll send you to one of those PT places to get that like management, and all they really do is movements. They make you do a bunch of movements for like 6 weeks that don't really do anything, and they kind of tell you, oh, just you're gonna have to just live with it, just do your movements and call it a day. Guys, that is not good enough. We have way more things out there, and I'll do separate videos on each of these separately to talk about management. But you absolutely do not have to live with this the rest of your life at that capacity. It should be almost unnoticeable. You should be able to manage it on your own, and you should have tools and supplies that help you with that and to know when it's getting bad and when it's not bad. So I will be doing videos on those. You guys can call and set up a virtual if you need to. If you need more information on what manual lymphatic drainage is and how it works for swelling, I have tons of videos on that as well. And I will see you guys soon. Have a great rest of your day. Bye.